All right. Hello, everybody. This is Coresair Mack, President of the Illinois Mental Health Counselors Association. And today I am joined by one of our past presidents, Jennifer Froemel. She has agreed to do an interview with us and hopefully to impart some knowledge and wisdom on you all as you continue through your counseling journey. So, first things first, Jennifer, how are you?
I am good. I'm good. I've had a very busy summer, doing a lot of self-care and trying to get back into life, right?
Right, exactly. I 100% agree there. All right, so let's get into our first question then.
Yeah.
So, a lot of people are wondering, how did you become interested in counseling?
Well, I actually became interested in counseling because when I was in my bachelor's program, I had originally thought that I wanted to be an attorney. And then in taking my first poli-sci course, decided that was like a fate worse than death. And when I had gone into college initially, my honors psych professor or teacher in high school was like, you need to be a therapist or a counselor or something. You're so good at this. And I was like, I am not doing that. I'm not going to make enough money. And then, when I was in that space, in college, I was like, well, I could be a psychiatrist. I think psychiatrists make more money than counselors. And so I ended up double majoring in pre-med and psychology and minored in Spanish. And then when it came time for me to decide, like, what do I do? Do I take the MCAT? What do I do? I started studying for the MCAT, felt really uncomfortable with the MCAT. And so I thought, go the GRE, take the GRE, apply for a master's in psychology. I naturally really enjoy the field, like just in terms of like just the topics. And my GRE scores came back and I applied to school and that was that. But I think the additional piece to it was that when I was 8 years old, had a really great experience with a school counselor and was like, well, if I'm not going to be a doctor, I mean, I guess I could be a therapist. So, because I really did, I really enjoyed my work with her as an 8-year-old.
All right, perfect. Great. So, speaking of schools, right, transitions great to our second question because a lot of people, when they are starting their counseling journey, they really don't know what schools to go to. So, what schools did you go to for your undergrad and your graduate degree?
So ironically, I did not painstakingly go through like what school is the best school and I've got to get into that school kind of a thing.
Mhm.
I actually just went and looked at schools and whatever the school was that felt right to me was what I picked as long as they had, a major that I was interested in.
Oh,
So I knew that I wanted to minor in psychology for my bachelor's degree. And so, when I went to school, I just picked a school that I knew had psychology there.
oh,
So I went to
nice.
Millikan University in Decatur, Illinois. And then when I graduated and took the GRE or, took my MCAT and realized no, and then I took the GRE and was like, well, there's so many different schools to pick from. And so again, I just kind of like went with what made sense to me. And so I picked Roosevelt University. And while I was at Roosevelt University, I also worked full time for Metropolitan Family Services. And so I went to school full time and worked full time, and it was ideal. I was working in their downtown office. And literally, just anytime I needed to go to school, I was like right there, because I had to go to work and had to go to school. So it worked out perfectly for me, at least. And the unfortunate fact, I think, for me was that my school at that time was not K-CREP because K-CREP wasn't a thing. And so as I have looked at kind of growing my business and expanding myself in other states, that's one of the negatives about not having gone to a K-CREP school. But again, you can't go to a K-CREP school when they don't exist. So for me, I continued on with the clinical psychology, and that was what I did.
All right, perfect. So then, now I'm assuming you've been out of school for a while. Right,
Just a smidge. Yeah.
right, exactly. So then how long have you been doing therapy for?
Well, when I was in undergrad, I actually worked for a residential treatment facility in Decatur, serving mostly DCFS kids, and that was in 1991.
Oh,
Um, yeah. And so in that way, I've been providing counseling, I guess you could say. And I also worked in a domestic violence shelter there while I was in school. And so, yeah, I guess since 1991, but then as a master's degree individual since 1996.
okay. Well,
Yeah,
so yeah, if you have a plethora of knowledge and information for us, I love it.
I do. I do.
Okay, so then speaking of after your graduate degree, a lot of people are struggling to find as well as settle in on a place that'll best fit them, especially to do counseling. So, what places did you start off in your profession, and what did you learn as a result from working at those places?
Yeah. Wow. We're going to go down memory lane, right?
Right.
So residential treatment I thought was awesome. And as I was in my master's program, that was one of the things that I wanted to look into was, looking at doing some research based on individuals who are born, like who are raised in that kind of environment. And are we serving them well enough? Um,
Yeah.
so from that time, I ended up moving while I was in my master's program. I did the work at Metropolitan and was doing their centralized intake. I was doing about 300 evaluations a month, all via phone in
Mm.
Spanish and English for different services. And they had an employee assistance program, and they still do. And then they had their family-based programs, they had their individual-based programs, their basic community mental health model as well. And so I had to kind of pick between what was somebody best served in. And I really think that that helped me a lot to like hone in on just basics with, what might benefit a client, and where does a client get best served. So from there, I did go into community mental health directly and worked in the community of Cicero and worked actually hand in hand with Madden Mental Health Center. I was the liaison to Madden and carried a pager 24/7.
Oh, wow.
Um, yeah, it led you to lots of experiences.
Right.
But I carried a caseload of mostly chronically mentally ill adults. And while I was doing that, I recognized that, like, as a provider, that's really probably not the best thing as a provider, because you don't
Mm.
really end up getting to see the walking well or the walking wounded. You're seeing really catastrophic, mental illness,
Right.
and a lot of lack of support in community mental health. And so it was during that time that I started to think like, well, if I can't get like a varied caseload, I think I need to leave and do something else. So I did. I left and I was the director of the Young Girls Program at Mercy Home for Boys and Girls. And I had I think we had 12 girls. And I had a clinician who was our milieu clinician, and then our direct line staff. And so I really kind of brought back those group home days from when I was in Decatur. And I really loved it. Having to learn all about the different accreditation standards for those programs. And I heard from my boss that, she'd never had anybody who'd gotten accreditation as quickly as when I was there, which I was kind of like, yeah, right, whatever. But apparently it was true.
Yeah.
I really understood the accreditation standards, even if they were nonsensical. It was something important, and it really helped with the milieu development, which it was interesting because with my transition to that position, a lot of the direct line staff were really not happy because I was keeping the clinical aspect of what we were doing for those youth in the forefront. And their previous director was not. Their previous director was more focused on just kind of educational component of growth for youth. And so I really loved it until my boss kept telling me that, a 50-hour work week is not enough. A 60-hour
Oh,
work week is not enough. Then I got when are you moving here? And I
Oh,
was
wow.
like, that's not appropriate. Actually, it's better for me to have a good work-life balance, for me to have my own life. And then she was like, well, no, that's not. Mm-mm. And then the next was, you need to eat what the kids are eating. And I was like, they have a high fat diet as an adult woman. No, I should
Right.
not. And I'm showing them, I'm modeling a good model, right?
Mhm.
And so it just became a point of contention that I wasn't meeting needs. And so I was like, okay, while I love residential treatment, I'm clearly never going to meet the standards. I'm not going to move here because that's not healthy. I'm not going to keep eating what they eat. And so I decided back to community mental health because I felt really comfortable there. I really enjoyed the variety. I just wanted a variety of cases. Um, and so I left and went back to community mental health, and worked a lot in Harvey, Illinois, and really enjoyed that work, working with youth and families and couples. And, we were able to do kind of whatever, it was like,
Oh,
I want to do groups over the summer. We did groups, we wanted to take the kids on an outing. So we would take the kids on an outing every week. It was a really great way to work in that community setting, but you were able to give them that clinical guideline as well as modeling, which I think was a big part of what I enjoyed about, residential treatment. Um, and then things there were okay, they were fine. And then I started to work as, again, like a hospital liaison with River Edge Hospital. And River Edge Hospital basically enticed me to leave community mental health.
oh,
And so I left and went and worked at River Edge Hospital, and worked there for 2 years. I would say that inpatient work is probably grueling. The best word I could use is grueling work.
right.
I think it's changed a bit now from what it was when I was there. But to suffice it to say, I mean, I really thought that it was going to be kind of the holy grail of clinical improvement. And what I learned quickly is it wasn't. It's a short-term Band-Aid approach to helping people long-term. And if the program isn't set up in a way to really focus clinically, you're going to have what I think in inpatient is called, like, your revolving door people. And the other thing that I started to see there too were kids who were in DCFS placements that were getting stuck there because they weren't fitting in the placement correctly, and the placements were failing them. And so then the kids would end up getting stuck in the hospital while they waited for a new placement.
Oh, wow.
In addition, I saw a lot of youth that probably could have gone through juvenile corrections rather than psychiatric hospitalization. And so it was during that time that I was like, oh man, like, I can do a lot here, but my hands were also tied. In inpatient care, it was pretty clear that the focus is really on the medication and getting them stabilized and then getting them out the door.
Right.
And so I wasn't really buying into that because I knew how therapy can help change things. So I got enticed back to Cicero
Okay.
and got a call from their executive director asking me if I would come back and lead their program for their child and adolescent programming. And I did. I took it and was there for 8 years. And, in that process, oh, I forgot one place that I went to in the middle there. I actually worked in I guess, what would you call it? An FQHC, a federally qualified health center.
Okay.
I had gotten called because I had interviewed at one point, right before I went to back to residential. I got a call that they were developing a position and they thought about my skill set and they thought that it might be good for them. And in that federally qualified health center, we had more or less of like a home visiting program for Medicaid-based patients. And we partnered within that system, and it was outpatient medical care as well as dentistry. And so I was like I did a little stint as the Dr. Ruth for youth on Cable Access Network.
Oh, wow.
Which is kind of, interesting. We had a lot of like after school questions about sexuality and relationship stuff. So that was fun. I also got to start a group of, what is that? The National Health Service Corps chapter. And we started to do HIV counseling and testing at the clinic under my supervision. I directed the community mental health program. Back at that point, we had home visitors going to Cabrini Green because Cabrini Green was still a thing. And I'd have clinicians calling me from like their giant phones going, Jennifer, there is a line of blood from the front door. Should I go in? And I was like, oh, maybe not today. Maybe not today. There's still police presence and stuff. Yeah, probably not. Let's call instead. So, telehealth, right? Like we did a lot of telehealth back then, with those clients. And then while I was there, I actually decided to open a private practice. And so I have been doing private practice work since 1999. And so then, I had gone back to Cicero and was directing the program there and was doing a lot of integrative care programming in medical models that were not typical to have behavioral health in them, like community health centers and things like that. And loved it. But I was like, yeah, what else could I do? And so then that's when I built Innovative Counseling Partners and truly started more of that integrative model, working with, pediatric occupational therapists within their office, non-traditional medicine docs in their office, and then, standard traditional outpatient mental health programming in a private practice setting with commercial insurance. So that's my history.
Yeah, you have definitely been busy.
I've been busy. Yeah.
I feel like we need to take a break after that. That's a lot of stuff.
Yes.
But no, thank you for that. That definitely
Sure.
helps give us a lot of information as well as things people to look out for when they're going to look for a
Yes.
job. So,
Yes.
well, speaking of jobs,
Yes.
something had to have caused you to say, you know what? I don't want to do community mental health anymore. I want to get into private practice. What was
Yeah.
that for you?
Well, I mean, I think probably like most of us when we're in grad school, we have that vision of like, having our own cozy space on Michigan Avenue and, being able to see the patients we want to see and, and making
Right.
a good living, right? And so I think there was a part of that for me. And I think when I started my private practice in 1999, it was about like, I wanted to manage something of my own. I didn't want to necessarily have somebody tell me, here's all the hoops you have to jump through. And these are the clients you have to see and you can't see other ones. I wanted to be able to, somebody shows up, I want to be able to screen them myself and make a determination. Do I want to take this client on? And so that's really what made me go into private practice. And I did do it very, like I think 10 hours a week from 1999 until 2014.
Oh, wow. 10
Yeah.
hours a week.
10 hours a week. Yeah. Plus my full-time gigs.
Oh, there you go.
Yeah. Oh,
That's
and
great.
I didn't also mention I was an adjunct professor at DeVry University
wow.
for a couple of years. Yeah, running their accelerated psych program. It was super interesting because you're talking to people who want to be working with computers and not with people.
Right.
So yeah, it was a really interesting thing to do.
Man, when you said you did it all, you actually did it all. That's amazing.
I have. Yeah.
All right. So speaking about the private practice, a lot of clinicians, me included in there for a little bit, we were always wondering, how do you actually go about starting it? So what was your process and what hurdles did you have to overcome when starting your own private practice?
Well, my individual private practice, it wasn't that difficult to start.
Okay.
In the sense of, again, like it all depends, I guess, on your tolerance, right? Of what you think is difficult. So for me, it was like, okay, so I get a business license and, okay, I get a tax ID. All right. And then I was like, well, I think I'll just, put myself in with Blue Cross Blue Shield and, oh, there's this group called Psych Health. Let's do that. So I just got myself in, completed the credentialing documents for both of those and went out and looked for an office space that felt right to me. And I actually started with a sublease and just started doing it. The billing was all by hand. Unlike now,
Yeah.
there was no such thing as Simple Practice or Theranest.
Right.
And then, getting a fax line and faxing in the forms and then following up with insurance and collecting your copays. All of that was how I got started. And literally, it was just Psychology Today as my other resource of, where I would put myself out there. And then Psych Health and, being in network with them, and then being in network with Blue Cross Blue Shield.
Okay.
Yeah.
Yeah. Well, that sounds a lot more simple than what I had to go through. So I'm glad it was very simple for you. But yeah, you make a really good point. It just depends on what people would consider difficult, and do they have the tolerance to go through that?
Correct. Yeah. I mean, in 2014, when I decided to leave community mental health and to start the group practice, I kind of thought, oh, it's just going to probably be as simple. It wasn't as simple. And it continues to not be as simple. But I think that's the piece is like, I love it. It's, there's never a same day. I don't get bored. There's always something happening, even when I don't want there to be. But I love it. I think, as I said in the beginning of our meeting, like I've been gone a lot for a middle chunk of the summer. And in that middle chunk of the summer, I was like, I miss my work.
Yeah, definitely. And I would say you definitely have invested a lot into your private practice, right?
I have.
Right. So then, speaking of that, right, I won't go fanboying over all the stuff that you've done in their, locations and things like that. But what are some things that you're currently working on in your private practice that you would probably want people to know about?
Well, we're beefing up. So we do a lot of training. I think one of the things that I learned in all the places that I've worked, whether it been residential, outpatient, inpatient, what I always took away was how a lot of programs don't really train clinicians well. And so when I started ICP, that was one of the things that I decided I couldn't let go of. I wanted to continue to supervise and train newbies. And that was something important to me. It's like, we're not really getting paid for it, but for me, it was more about the passion of giving back to, the development of students. Because in almost every setting that I was working in, I would have to take on an intern or a student. And I really loved it. And so I think in that way, having that was important. But as time has gone by, I've shored up what I've been calling like the meat and the bones. And now I'm like, all right, now I want like to put the tendons on there. I really want to tighten up all the clinical supports around not just the development of our provisionally licensed or our student population, but also for providers. I think private practice models, they can look very different. And mine, I want to be my ideal of what I wanted to see for us as growing professionals in all those settings that I worked in. And so I'm really tasking myself to that. So presently, that's one of the things, and hiring a director of clinical operations that we're actually working on presently. And then outside of that is I'm really been wanting to bring in equine therapy for quite some time. And so since March, I have been working with a wonderful horse named London. And I'm starting to, bring clients out to work with London and I. And so that's something that I've really been wishing and wanting for, as well as including more of the kind of outdoor aspects of mindfulness and meditation and just outdoor, ecotherapy. And so have been more and more into working in those ways with clients, and then training our clinicians.
Yeah.
Yeah.
That's amazing. Equine therapy.
Mm-hmm.
I think the first time I saw that was during one of either ICA or IMHCA's annual conferences.
Probably Sandy Kakasik.
Yep,
Yep.
exactly.
Yeah.
So yeah, hearing that you're doing that, that's awesome. I hope that picks up, takes off, and you'll be riding horses with clients. Who knows?
Who knows?
Right.
Right.
Mm-hmm. Right. So speaking of IMHCA, you, my friend, are a past president.
Yes.
So from 2015 to 2017, you served as the president of the Illinois Mental Health Counselors Association. So that's amazing in itself, 2 terms. So you must have been doing something right. So let's see if you can remember all the awesome things that you've done. So what are some of the accomplishments that you're most proud of during your 2 terms as president?
Oh my goodness, I don't remember, to be honest. I know that one of the pieces that we were really big about at that time was wanting to ensure that we were paying our, our leadership in terms of the role that Dan Stacy played. Wanted to ensure that that was done in a way that made sense, that wasn't antiquated. I think the additional piece to that was ensuring that there was a model for providers to know that they could step in and, be part of what the association does. So the development and like the refining of the strategic plan of IMHCA was important. And then, just again, like realigning and looking at the relationship to AMCA was again another aspect that I recall spending time on. And then of course, I think, keeping in touch with the insurance task force and like what insurance is happening, all those happenings that are happening, and that providers are fully aware, and that providers' voices are at the table. And let's see, I think the other one was my piece about, wanting to ensure that the leadership of and the voice of the counselor in Illinois is being heard by our lobby and our lobbyist. And so I know that was another thing that, I really pushed on because I really wanted to make sure that we did that. And then I also recall, like, I wanted us to have some big names for our providers to show them that, that we can have, some people who've, really been out there. I remember we got Stephen Hayes to come in, and that was awesome. So those are some of the things that I remember.
Okay. Well, I feel bad asking you this next question then. But what are some things, if you can remember, that you wish you had more time to work on as president?
Oh, gosh. Yeah, I mean, it does go pretty quickly. I think, again, it's more so the wanting clinicians to understand the value of being part of your association. And I think, even as a director of programs and now, the owner of a decent sized private practice, I feel very much like I can tell them, that it's so important that you understand the value of being part of your professional association and your professional identity. But I don't really know how best to help them really get that. And part of that is like, is it because those of us that are here, that it is kind of part of our passion project, that we do a decent job, so they don't really think about it. I think the other was really helping the students, understand from early on, the value. I think so many students are like in love with the NBCC, but don't get that the NBCC, once you pass your LPC, is really, as opposed to being part of ICA or IMHCA, where that's a place where you're actually having people work for you and understand who you are. Where, I feel like NBCC is kind of interested in making sure that you pass that exam, and giving you information. But again, it's giving you information in a bubble as opposed to like for your specific space. And again, if you're in Illinois, it's Illinois.
Mhm. Yeah, definitely. Perfectly said there. So then, with that tidbit of knowledge and information that you imparted, is there anything that you'd like to tell people that are starting out in the field or have been in the field for a little bit?
I think that a lot of us don't necessarily appreciate all that we do and, the intricacies of our work. And I really want providers to love themselves, right? And see, and have more compassion for themselves. And I think so many times, because of the fact that we serve, I think there's a lot of people who don't necessarily maybe go toe to toe with the powers that be, right? Whether they're insurance or whatever it is, your professors or your executive directors. We allow some of those systems to continue to berate us, not see our value, and I think that is it's a sad thing to see. I think a lot of us come into this profession because of stuff that we've experienced, whether we wanted to or not. And so we found ourselves through this work, and then we put ourselves out there and we think we're all healed and better, only to be put in a position again of, being minimized or maybe financially abused. If you look at it for insurance perspective,
Yeah.
Insurances make us jump through all these flaming hoops that are somewhat reminiscent of trauma, right? Like, you don't deserve this because you didn't cross this one T or put the dot in between the Z49.23. And I really want providers to understand that, we hold a lot of value. So find your value, stick with it, and stand up for it.
Yeah, 100% agree with that. Find it, stick with it.
Yeah.
All right. So before we get into our final questions, I had to do a little bit of research about you. And I found that you did an interview with Team Med Global, and you mentioned the Dalai Lama. So what would a day with the what would a day with the Dalai Lama look like? And what questions would you ask?
Wow, that's a good one. Yeah, I think a day with the Dalai Lama would be perhaps helping me see the value I hold in my humanness, and also to tie myself more to that general sense of spirituality that we all hold. But, I think sometimes societally it gets smushed out of us in some way if we don't pay attention. But I'm hoping that, when and if that day comes where I am able to work with him and sit with him, I really would want to hear from him how he best manages, being in that spiritual place, yet accepting his humanness.
Oh, wow, that's deep. I'm gonna need some time to think about that one myself.
Yeah, well, sometimes that's what I do.
Right, there's nothing wrong with that.
Yes.
All right, so the second to last question. So is there anything that you would want to say that I haven't had a chance to ask you about?
I don't think so, Corsair. I really, I'm really glad to see you in this position of leadership. Having known you, being our student liaison when I was on the board, and it's just so great. Again, just to see growth and development, and you stepping into yourself and in this position of leadership. So I just hope that others, recognize the value. If it weren't for Fran Giordano in 2005 telling me about IMHCA, I wouldn't be here. in this position, still chairing the insurance task force. And in not being in that position, there's a lot of things that, I don't get paid for about being in that position, but I really am honored to do for the benefit of our growth and development as a profession. So I really hope others can see that, and that you can impart that as well, as much as I can.
Yeah, it's true. I've been a part of this since 2014, so it's been a long while, and it is valuable.
It is valuable. Yeah.
All right. So now, the last and most valuable question of the day: where can people find you?
Oh, well, they can find me at our website, innovativecounselingpartners.com. They can find me at Psychology Today. You just search Innovative Counseling Partners, or you can just do a simple Google search and Google up my name, Jennifer Froemel. And I think there's also a link to my number or my contact information at the ICA website as well.
No, I'm pretty sure there is, right?
Yeah.
You're a VIP there, as well as everywhere.
Right.
All righty. Well, thank you very much for doing this interview with me. I really do appreciate it.
Thank you.
Right. And hopefully we'll get to do another one soon.
Yes, that
I'm
is the
pretty sure
hope.
you have a lot of stuff to do.
Yeah. Awesome.
All right. Other than that, that's about it. Thank you guys very much for watching. My name's Coresair Mack, president of the Illinois Mental Health Counselors Association, and I'll catch you at the next interview. Talk to you later.